Now we are starting the press conference by Prime Minister Suga. First, Prime Minister will provide opening remarks, and then we will take questions. Prime Minister, you have the floor. Earlier today, COVID-19 headquarter meeting was held, and we discussed the state of emergency. For Tochigi Prefecture, the emergency will be lifted on February 7th. Saitama, Chiba, Tokyo, Kanagawa, Gifu, Aichi, Kyoto, Osaka, Hyogo, and Fukuoka. For those prefectures, the state of emergency will be extended to March 7th by 1 month. So far, we have received a lot of support by people of Japan. We would like to send our appreciation. In all the regions, we couldn't end the state of emergency. We would like to apologize for that. And recently, the state minister and also the LDP members were doing dining until the late at night. This is something that should never happen. I would like to apologize for that from my heart. Nationwide and Tokyo, we have prepared a graph of the number of infected people. For the nationwide, the new cases, it was January 7th, 7,721. It was the first day of the state of emergency. It started to decline. Yesterday, it was 1,783. In Tokyo, it was 2,447 on January 7th in Tokyo. There was a great decline. Yesterday, February 1st, it was 393, and today it was 556. As you can see, because of the measures that have been taken and also the support by the Japanese citizens, we have seen visible effect. Once again, we have to ask for further support by Japanese citizens so that we can make a decline of the infection sure thing. We have to do it. That is the decision that we have made. For the going forward, with the eating and drinking establishments, shorter operation hours, and there will be other focused approach we are taking. So we see the declining trend, and we will continue to see that number of hospitalization and the number of people with severe symptoms, they have to also decline as well. We want to restore the life with the safety. In March, there will be graduation ceremonies and a spring break. We have to have thorough measures. For those prefectures that see the turnaround, even before the March 7th, we may lift the state of emergency. We continue to work with the local governments so that we will make utmost effort and secure the medical preparedness. There will be a lot of restrictions in life, and we are causing a lot of inconvenience. But once again, we would like to ask for your further support. Ten prefectures will be extending its state of emergency. For those prefectures, there are some regions the number of infections are not declining, and many regions the medical institutions are stretched. We continue to implement the measures so that we can make the decline the sure thing, and the new cases, hospitalization rate for those indicators. We aim at stage 3. When it comes to new cases, it is 500 per day in Tokyo and 300 per day in Osaka. That will be the level we aim at. And we have to see the less strain in medical institutions, shorter operations for 8 o'clock at night, refraining from non-essential outings, more remote working, and restrictions in events. We continue to take those measures, and we have to make a request once again.
As for eating establishments, in between or between sittings and the seats, adequate spacing, and there has been a guideline for the distance in between. So I'd like to continue to abide by such a guideline. And about the state of emergency, it is continuing in some areas. And once again, I'd like you to thoroughly implement the measures. And some measures effects should be further visualized. And if we have an improvement of the current status in some prefectures without waiting until the expiration date of the 7th of March, in phases, we'd like to lift the restrictions or the state of emergency and the Special Measures Act and the Infectious Control Disease Act revisions are being deliberated in the Diet session and about the measures. They have to be more effective. So both parties and the ruling parties and the opposition camp are now giving us a support, and the penalties, fines should be combined with benefits. So that was enabled thanks to their efforts, and we'd like to have a swift execution. And including the severely ill people, necessary people have to receive necessary medical care. And healthcare system has to be ensured with all-out efforts. And the people in the field shouldn't have any reservations in terms of financial conditions, and medical institutions where people can be taken care shouldn't be financially stricken. Over the last 1 month in Tokyo, by collaboration between the state government and the local municipality, we were able to enhance the number of beds from 3,000 to 5,000, although new infections are now declining. However, the people who are hospitalized will not decline for the time being, so therefore we have to make sure that we don't slacken our efforts. About vaccines, there's a delay from 3 companies, 314 doses. Provision was already signed for the contract. And about the signs or the start of the inoculation, so we have been talking about the late part of February. However, it has to be as soon as possible. With that in mind, we have been making efforts, and efficacy and the safety have to be confirmed. And afterwards, by the mid part of February, inoculation should be started. And starting with the healthcare professionals, and as for the elderly, it should happen starting in April, and across the government, we'd like to execute our preparations, and for local municipalities, the best possible provision of the information should be shared in a swift manner, and the cost should be entirely covered by the state and national government. We have to make sure that all the people can be inoculated without any reservation, and the effects and efficacy and the side effects, such information should be swiftly shared. And about the new variants and mutation, we have to enhance our system for identification, and with a high sense of urgency, we will stay on alert. And the measures will stay the same, however, wearing a mask and washing hands and a version of 3 C's. Such basic anti-infection measures have to be even bolstered from now on. About COVID-19, now we have a protraction of the situation, and across the government, unprecedented support has been given. However, there are some voices calling for further support. The cash on hand in this regard, some people are struggling, and the small amount cash provision is now being provided, and as a cap of 1.4 million is going to be extended to 2 million. And a repayment will be also exempted for some people. And the people who is dwindling income and suffering from rents, we have some provisions and benefits to be provided. And another 3 months worth rent will be provided or will be supported. And for large companies and non-regular workers, the leave support or the allowance and wages are not provided, or the employment adjustment funds are not being utilized, and we have to cover such issues as well. In a swift manner, we will respond. And we'd like to also listen to the opinions of the ruling coalition. And with a multi-layer safety net, we'd like to protect businesses and the livelihoods of the people so that the financially stricken people will be assisted.
With the measures we have taken, we see the declining number of new cases. We see the real effect. That is because of the support given by each individual citizen of Japan for the next month, because we extend the state of emergency. Nevertheless, we will take thorough measures. We make sure we provide the support for people who are struggling, people without symptoms, and infected people with the mild symptoms. Because of those people, the infection is spreading. And across the generations, we see the infections among the elderly people. Even if you are young, you may develop the severe symptoms. Even though we don't see the clear linkage, there are what is called after effect is also reported. So please make sure you have the ownership on this one. The dining with the family members should be done with a small group. We have to refrain from going outside. If it's not essential, we refrain from eating and drinking without masks. With that, we can make a great decline for the new cases. It's been more than 1 year since the outbreak of COVID. In Japan and also in the world, we continue to fight against the virus. I run every day with some worries and struggle. We want to alleviate the concerns by the people. We take all the possible measures. I dedicate my utmost efforts. Once again, we ask people of Japan to give us more support. That is all from myself. Thank you. Now we take questions. Mr. Omi, please go to the stage. And some questions may be answered by Mr. Omi. When you are called, please come to the microphone. Please identify yourself and affiliation, and please ask one question. After you ask your question, please go back to your seat, and please do not ask question from your seat. Now we take question from the representing media outlets. Shigeta-san from Nikkei will ask a question.
Nihon Keizai Shimbun, my name is Shigeta. So you have mentioned the extension of the state of emergency. Shorter working hours for eateries was focused, and compared with overseas countries, I think they're more relaxed, and I think it's one of the causes for not being able to calm down the situation over the last course of 1 month. How do you see this? And about the leave and the suspension request from the 4 prefectures, how do you respond? And do you think you can totally lift the emergency in a month? First of all, over the last course of 1 year, based on the lessons learned from COVID-19, we have different measures from lockdown measures, so to speak. And this time, having listened to the opinions of experts, shorter working hours of E3s, and a focused approach was taken. And since the state of emergency was declared, 1 month passed, and in Tokyo and other areas, new infections across the board are dwindling, and we have a visible effects coming up. Against this backdrop, for the 4 prefectures, the business suspension is not being requested. However, the E3's related countermeasures will be further bolstered. That is going to be the basic approach, and by doing so, we'd like to make sure that the infections, again, are cut back. As for E3s, taking the right distance between seats in E3s, eating and drinking establishments, the guidelines should be followed so that the infection risks can be alleviated on a continuous basis. That's what we want to see. And we'd like to see also the comments here, the comments from Mr. Omi regarding the effects of this time. Like Prime Minister had said, this time, compared with the Western countries, we don't really have a situation like them, lockdown. And unlike what happened in April, we have a focused approach. We try to focus on the areas wherever or the areas of focus. And with a lot of people cooperating with us, the number of reported cases are now, for sure, declining. So I think we can highly evaluate such efforts and achievements. On the other hand, as for medical institutions, we still have a burden, including health centers. We still have a strain observed and state of emergency. And for 10 prefectures in question, the speed of the infection has to be further cut back. And the beds and the healthcare professionals have to be secured, and we have to also take countermeasures for the people with severe symptoms.
それでは
Now we take another question from TV Tokyo. This is Shinohara from TV Tokyo. As you mentioned in your opening remarks, medical institutions are under strain. In order to concentrate medical resources to people with the severe symptoms, the COVID-19 should be changed to the Category 5 in the Infectious Act. Some pointed out what do you make of that. Another question is about the Tokyo Olympics and Paralympics. Mr. Mori said that the games without spectators is one of the options. And what do you make of that as well? Let me first answer your question about Category 5 within the Infectious Disease Act. The patients with the COVID-19 may not be hospitalized, and they may not be isolated. I don't think this is appropriate choice given the situation. And also, we are making utmost effort so that we can reduce the burden on the medical institutions. Patients with the severe symptoms are first in line for hospitalization. That is the efforts that are being made by the local governments. And those doctors and nurses, the subsidies have been increased. And we support outsourcing of the cleaning of the facilities. We continue to implement those efforts. You also asked about Tokyo Olympics and Paralympics. About the spectators, we have to look at the infection home and abroad. We have to have a games with safety and security, and that is our top priority. That is my answer to your question. Maybe I should hand over to Dr. Omi. I'm not the one to answer your question about the Olympics and Paralympics. You asked about the category 2 and category 2 of infectious disease. Some people say it should be category 5 of the infectious disease. Well, so some people say this novel coronavirus is not severe. It is very similar to usual cold. But when it is categorized as a category 2, patients have to be isolated to be treated. And there are discussions that the measures that are being taken are too stringent. I do not believe we should change the category to category 5. I mean, we have seen a lot of progress in a discussion. The cabinet orders were issued, so people who need them, they should be hospitalized. And this is the cabinet order that was issued. However, that message is not necessarily understood by the medical institutions. So we don't have to hospitalize everyone. That is what is stipulated in the cabinet order, and that essence should be included in the law. So such a message have to be rightly understood by medical professionals.
以外の
Now we'd like to also listen to questions from other media outlets. And please raise your hands if you have any questions. I will nominate who can ask a question. And please proceed to the microphone. Mainichi Morita-san. Oiter is my name. Mainichi newspaper. Prime Minister. Regarding the 10 prefectures, if the situation is rectified over time, there will be a lifting without waiting. However, what will be the timing for revisiting the number and monitoring? And about the criteria for decisions in Tochigi Prefecture, the number of new infections, and so in terms of the population, per population, new infections are stage 3 is the current number, and stage 4 for bed utilization. So is it going to be one of the criteria? Including Tokyo and across Japan, the number of infections is now dwindling. And around shorter working hours of eateries, I think we have visible effects, and about the 4 prefectures in question. So we have decided to extend the state of emergency for another 1 month, and for 4 prefectures and others. However, until the expiry of the state of emergency, we'd like to thoroughly implement some measures to have the decline. And we'd like to thoroughly implement the measures. And if we have any improvement in prefectures, some prefectures without waiting until March the 7th will lift. However, first of all, we'd like to aim for lifting the state of emergency across the board in advance. So category 3, like I said before, stage 3, 500 people per day and 50% bed utilization. So that was mentioned for Tokyo. So first of all, we'd like to aim for stage 3. That's our aim for the time being. And beyond that, and of course, we have to listen to the opinions and experts. And wherever possible, we'd like to lift the declaration or the state of emergency.
次の
Now we take another question. Azumi-san, freelance. Azumi, freelance. Let me ask about the electricity supply. You said we have to make further effort. When we think about COVID-19, we have to work together if it's government or citizens. On the other hand, the electricity is very important for remote working. In the winter, power supply is very tough. On January 12th in Kansai Electric, 99% was the utilization rate. And for 17 times, they needed to be supplied with electricity. So that situation is under strain. What is the government going to do? If we experience blackout, most of the people may be in a critical situation, let alone remote working. Are you going to take serious measures against that? You asked about electricity. It is true that electricity is under strain. And many electricity companies that utilized electricity with each other, and we overcome the issues. The power supply needs to be secured, though the dormant facilities have to be up and running. There are many efforts being made. So the electricity will not experience the crisis, and that is kind of the measures that we are taking.
Now we'd like to receive questions from another person. Osanai-san of NHK. Osanai with NHK. This time, one of the causes for the state of emergency extended is a better utilization, and we have to eradicate the people's worries over recuperation at home. How do you see this? So first of all, the healthcare system has to be ensured with all-out efforts. That's what we have been doing. And COVID-19 patients have to be accepted by medical institutions, and medical institutions should never be financially problematic because of this. And the national government and the local municipalities have to tie up with each other to address each individual medical institution. Like I said before, over the last 1 month, around 2,000 beds have been added to Tokyo. And as for the people recuperating at home, if there are any symptom changes, immediately those situations have to be seized so that we can connect them to medical institutions and pulse oximeters. And such provision and assistance will be provided by the national government so that in each local municipality, the conditions of patients can be solidly monitored. And between the national government and the local governments, we are trying to liaise with each other to make it happen. Do you have any input, Dr. Omi, about the people who are recuperating at home? We have more of them. And for those people, we need to follow up, like visiting them and providing online medication or diagnosis. And pulse oximeters. Assistance is also needed. At the same time, the hospitalization and the transfer of patients between hospitals is being problematic, and health centers are struggling. I think one of the solutions would be health offices shouldn't be left all the responsibilities for coordination. And there are some task offices in each prefecture, and clinical professionals have to be appointed for coordination. And that's working in some areas and prefectures. And public health centers staff members are working so hard, so they have to be somehow supported by clinicians or clinical physicians. And those people should be the key player for coordination, and they have to be appointed as the officers or the each prefecture staff members.
では次のご質問。
We take another question. Sato-san from Hokkaido newspaper. This is Sato from Hokkaido newspaper. Tomorrow, the reviewed Special Measures Act will be passed, government can impose the penalty. It may restrict individual rights. However, we see the scandal of the policy makers and ruling party members were in Ginza very late at night. In order to impose stringent measures, there have to be the trust for the government. What do you make of that? So is it possible to impose the stringent measures under the state of emergency? Another question. You are using prompters. I think there are some reasons. What is the reason why you are using a prompter this time? Well, I'm using a prompter. We wanted to send the right message to Japanese citizens. I always have an intention to fulfill my accountability. So we have received a lot of advice. Prompter may be conducive to send a good message. So it's up to people who interpret this, but we want to make a good use of prompters in some occasions. State minister and the ruling party members were dining late at night. I apologize for that. This is something that should never happen. You also asked Special Measures Act and penalties and communication period. We have to take into account communication period, and we want to enact the law as soon as possible. Based on the amended act, we will be able to take more effective measures, I believe. And also, the public announcement is made based on opinions by the experts. If there's a necessity to report to the Diet, we will do that so that we can avoid arbitrary implementation. And we pair support and penalties so that we can take effective measures. It is needless to say that we have to take care of the people's freedom and rights.
Now I'd like to take another question. Sugimoto-san of Sankei newspaper. Sankei Sugimoto, Prime Minister, you have said you have gone through all the thoughts before making a decision. However, I think you had to go through many thoughts before making a decision again. And so only one prefecture was excluded this time. Aichi and Gifu were not excluded, and that they could have been lifted. And 3 weeks, I think there was such an option as well. So leading to this decision, what were the areas of struggling, and through what process did you reach this decision? About the measures based on the state of emergency declaration, so they affect the livelihoods and the way that people live their lives. And there are lots of restrictions required. So therefore, lifting the state of emergency in many areas and shortening the term, I think there are various opinions. Against this backdrop, we have extended the state of emergency in many areas in order to curb the infection. And we'd like to also lower the bed utilization as well. Based on such a decision, apart from Tochigi Prefecture, for another month, we have decided to extend the state of emergency. As for the people of Japan, so they need to be asked for another month, such measures and restrictions. I feel sorry, but after the state of emergency declared, new infections are dropping day by day. And we'd like to contain the virus. And with such strong determination, I reached such a conclusion.
尾身先生からも一言あります。
Dr. Omi, do you have any input? As for the decision of Prime Minister, there was an advisory panel where his idea was raised, and 1 month instead of 3 weeks, and Tochigi being lifted, so they were raised to the discussion table for the advisory panel. And regarding these 2 points, basically, unanimously, we agreed, I think. And for making or taking measures, of course, we have to enhance our testing capacity. There was such a comment raised. And there were some minor revisions to the basic approach or policies, but the 1 month and only Tochigi being lifted for these areas, I think there was a consensus.
では、
We take a question from TBS. I'm Goto from TBS. Let me ask a question about the corporation money for eating and drinking establishments. So we expect there are focused approach for dining and drinking establishments. Up to 60,000 yen is the maximum corporation money. Why are you taking the measures only for dining and drinking establishments? There are different size of the businesses, but when you are providing 60,000 yen consistently, we may not be able to support the businesses. Do you think we have to be more flexible to provide the support based on the number of people working or sales? Are you going to be more flexible on this measure? First of all, for corporation money for dining and drinking establishments, we provide 60,000 yen per restaurant. We look at the average store. It can cover the fixed cost. And we are providing the support based on the store or restaurant. So even if you are the big chain, you will receive the cooperation money based on the stores. When we think about the allowance for the part-timers, when they have to take a leave, we are providing 330,000 yen per month. So we are providing such a support. However, some people are saying that the support is not wide enough. We are expanding the small amount money fund, and non-regular workers who are working for big companies, we are taking a more detailed and nuanced approach. So we are discussing what we can do about that.
では、
伊藤さん。Radio Nippon Ito, Prime Minister, in the Budget Committee of the Upper House with Ms. Renho, there was a dialogue and about the state of emergency declaration. So you struggled and you went through many struggles and thoughts, and what were the specifics behind it? About the state of emergency declaration, by doing so, a large number of Japanese citizens will be affected. There will be imposed restrictions. That's what I have to ask for. So, if possible, we'd like to limit the scope in terms of containing the virus or the spread of the COVID-19. So I tried to seek out all the options to make it happen. And about the declaration, within the night sessions, as a supplementary resolution, we had to take utmost precaution, and according to the resolution, I had to listen to the experts' opinions. But I had to decide, and the best possible decision should be exercised as a prime minister. So I talked to so many people by referring to all the case studies in the overseas nations. And amid such circumstances, I reached this decision. And towards the objective and target, now we are trying to steer our gear with all our efforts towards the containment.
いきたいと思います。
Now we take our next question. Sugiyama from Japan Times. Let me ask about economy and countermeasures against infection. You have been repeating the balance between economy and antivirus measures. However, infection is spreading. Now state of emergency is extending. Then there's a concern that this is another layer of the stress on the economy. So we are in a situation that because you are focusing on the economy, then that problem is not solved. Do you think your focus on taking a balance was correct? We have to protect people's lives and livelihood. This is the most important obligation as Prime Minister. We have to secure employment, and we continue the businesses. That is very important. And we are imposing restraints, in this case, state of emergency. That is why we have been struggling to make decisions. Against the backdrop, let me talk about the Go-To campaign. On December 14th last year, for the New Year holidays, I made a decision to suspend the campaign nationwide. That was the decision that I had made. And also, because of the Go-To campaign, the local economy was supported. It is another truth. Within the private sectors, the benefit was 5 trillion yen and 460,000 for the jobs that are supported, and the campaign also supports the local economy. However, when we hit the stage 3, Dr. Omi, who is the expert, back then we talked about Tokyo, Sapporo, and Osaka, and there was an expert's opinion we should not continue the campaign for those cities. And then we made the decision to suspend the campaign on the December. And so now you see our priority is to stem the infection. At the same time, the economy and jobs have to be protected. This is another priority. We have to put the emphasis, and we are providing a financial support. This is the current approach that government is taking.
の、
Sorry, because of time constraints, we'd like to take the final question now. Japan's Defense Weekly, Mr. Takahashi. Military magazine of the Ukraine is my affiliation about vaccine. From the mid part of February, you'd like to start inauguration. However, around the world, in 60 countries or so, there has been a launch. Why are we having such a delay and taking a lot of time in Japan? Japan is the only nation which is left behind in G7, and In OECD 37 countries, Colombia and 5 countries, including Japan, are the only ones. So national security and in terms of crisis management, I think vaccination is a very important matter. So why is it happening in Japan? And you have been saying that Japan is a science-oriented country. So why can't you come up with or develop made in Japan vaccines and testing-wise? 138th is a ranking amongst the world. So do you think you can go ahead with the Olympics and Paralympics? And I think people are expecting you to focus on the containment. And I'd like to also ask the same question with Dr. Omi. First of all, about the central government, we are trying to provide support for vaccination program. However, we still have a lot of time needed. However, in terms of securing vaccines, I think we're one of the first countries. So in terms of securing the supply, we were first. However, the time up until the inoculation is related compared with other countries because of the procedural issue in Japan. Because it takes a lot of precaution and clinical trials in Japan. So in this regard, I think there's a time lag in the reality that. But now, finally, now we have a readiness for the vaccination program, and they are set to now start from now on. And once it fully starts, compared with other countries, because of the organizational power, we'd like to provide such a program for many people. Dr. Omi, inside Japan, as you know, we have launched a production of the vaccine. So you have asked why it's happening in Japan. If you compare the holistic situation of vaccine of Japan versus the world, the vaccine industry in Japan, each country is doing its best. However, looking holistically at the Japanese vaccination industry, Western companies have a lot of competitive edge, and the economy of scale is probably one thing that we have to bear in mind. And so this is a completely new program as covered by the US and European media outlets. And we have some cultural differences between Japan and other countries. But I think the biggest difference is historically looking at the global competitive edge around the world. I think that is one of the things that we have to bear in mind. Sorry. However, time is up. So now we'd like to conclude this press conference. And the people who are raising their hands, so please send us a question by email, and then we'd like to respond in writing from Prime Minister, and we'd like to also disclose what we answer over our website. So with this, we'd like to conclude this press conference of Prime Minister. Thank you very much for your cooperation.